I tabled this motion because, like in many areas of healthcare at the moment, we have a lot of burnout and fatigue. And I've met over the last number of weeks and months many ambulance paramedics and members of the National Ambulance Service. And I'm sure the Minister will be aware as well of a lot of the pressures that the National Ambulance Service are under. And the words burnout, low morale and fatigue are words that we are hearing a lot of in relation to our frontline healthcare services, and it's no different in the National Ambulance Service. Yesterday I met with the SIB2 representatives, but also with many ambulance paramedics on a Zoom call. And again, I heard at first hand the consequences of what's happening in relation to the lack of capacity in our National Ambulance Service. No breaks, Minister, for many of those who are on long shifts. Often ambulance paramedics working 12 hours, they can't get a break, they can't even get a lunch break, and many of them talk about a desk top lunch because they simply cannot get time to eat properly, and that has a consequence obviously on them. The long hours that they work, very often at the end of their shift, if there's 15 minutes or 20 minutes left at the end of their shift, they can be given a call out to somewhere that's 100 miles, 200 miles, even 300 miles away from their destination, adding again very lengthy hours onto what already is a long shift. And many more consequences for the ambulance paramedics themselves. And there is real fatigue and there is real burnout, but there's also consequences for patients. We hear more and more anecdotal evidence from patients and from families, people waiting too long for an ambulance to arrive. And I put that directly to ambulance paramedics I met, including those from SIB2 last night, and they say that's precisely what is happening, that they cannot stand over a service where the response times are not what they should be. One ambulance paramedic remarked to me that he came onto his shift last week. He started his shift at 7:30 p.m. and his first call was to respond to a call that came in from a patient at 11:38 a.m. in the morning. And then he has to respond to that call, arriving 6 or 7 hours later and having then to deal with that challenge through no fault of his own. And there is an awful lot of what's called moral injury here, Minister, in relation to the impact that has on frontline staff. If you're an ambulance paramedic, you want to do your best. You want to make sure that you take whatever call is there. A child could be sick, an older person has fallen, and yet you know that you need a break. You know that you're coming towards the end of your shift, and you have to deal with all of that day in, day out. And that moral injury I'm hearing more of, not just in relation to the National Ambulance Service, but right across our healthcare system, and it all comes back to a lack of capacity. I know, Minister, and I can preempt some of what's in your response, there has been a number of working groups established by the National Ambulance Service to look at some of these issues in relation to breaks and late call-outs at the end of shifts in many of these areas, but they haven't been actioned, and what we need to see is even these small steps implemented as quickly as possible. I also know that there is a capacity review being conducted. When I talk to ambulance paramedics, they relate to me the nearest comparable region or country is Scotland. That has a staff complement of 5,000. We in this state have a staff complement of just over 2,000, so we fall far behind. Our fleet needs to be greater than it is. The number of paramedics needs to be greater than it is. We need more EMTs, we need more staff generally in our ambulance services. And the consequences of that not happening are ambulances not arriving on time, and more burnout and more fatigue. I've also been told by hospital managers in some hospitals across the state that ambulances can be parked up for hours on end because they don't have the beds to transfer or decant patients from the ambulances into the hospital itself. It can happen for hours on end, and we hear it all of the time, but when hospital managers tell you, I had ambulances outside of my hospital, sometimes a fleet of ambulances parked up for hours because we don't have the beds to be able to release the patients into them, and then the ambulances acting almost as hospital trolleys. Now, how mad is that? And how frustrating is that for ambulance paramedics and for people who use the service? So this motion, Minister, is a sincere attempt to say to you that we need action. I hope, because I think you should be able to support this motion, that you can support it. We're calling for the National Capacity Review to be complete, to be published when it is complete, and then properly resourced. And let's put in place a strategy for the National Ambulance Service that properly resources it, that increases the fleet, increases the personnel, ensures that we can provide a fair service, make sure that ambulance paramedics are fairly treated. Let's address the issues of burnout, address the issues of morale and fatigue, and put in place a plan that they can have confidence in. And I know that there is new personnel at the head of the National Ambulance Service as well, and I wish them well, and I want them to succeed. Minister, I would ask that you would support this private member's motion, but more than that, I would ask that you action the asks which are in the motion.